Hi, my name is Dina Haydon. I'm 56 years old, diagnosed 8 years ago, and I am one of many faces of IC.
Hi, my name is Neff. I am 34 years old and have been diagnosed with IC for 9 years. I am from Kentucky. I am one of many faces of IC.
Hey everyone, it's Georgeanna Wright. I'm 40 years old and I'm from Dayton, Ohio. I am one of the faces of IC, and I wanted to come on here and lend my support to IC Awareness Month 2017. Let's never give up hope. Let's continue to support each other, and let's continue to fight for better treatments and ultimately a cure. Much love.
Hi, my name is Jennifer Carey. I'm from Virginia, and I am one of the many faces of interstitial cystitis.
Hi, my name is Mandy Southerland. I am 42 years old. I am from Greenville, Tennessee, and I am one of many faces of interstitial cystitis.
Hi, I'm Dina Haydon, and I'm here to explain to you, before the personal stories, a little bit about what IC is. It stands for interstitial cystitis, which is an incurable disease that affects your bladder. But it also affects everything that surrounds the bladder, including the colon, entire pelvic muscles, and for a woman, her uterus. Right now in the United States and other countries, there are 2.5 million women that have been diagnosed with this disease. 1.5 million men as well. This disease is not prejudiced. It doesn't only affect people of my age group. It also affects children, teenagers, and young adults. The one that breaks my heart the most is a child who can be 9 years old and be diagnosed with IC. Knowing the extreme pain that this disease carries, I just can't imagine these young people's lives from that young of age to the extreme pain for the rest of their lives, at least at the time right now. I'm hopeful that when we put these videos together, that we're getting our voices out there. Now, before I get into the IC, I just want to say that we're not the only group that is putting something together during IC Awareness Month. There are hundreds of groups out there full of men and women like myself, and they're putting things together to get their voices heard. So what our goal is that there only needs to be one person that will hear us from whatever place it comes from and grabs a hold of it and tries to do something with our stories by either getting our voices out there more or possibly leading into a direction of treatment and better medication. So now I'm going to talk a little bit about what IC does to you. It is, if you were to look at a bladder that's normal versus a bladder that has IC, the normal bladder is kind of a whitish gray color with a black background, obviously. And then the IC bladder looks like it's blood. And that's just how raw it is. It looks like that on the inside as well. Now, what the bladder, the way I like to explain it is the bladder is a wound, a very fragile wound that is struggling to heal. And it never will heal because it's permanently damaged. On the inside of the normal bladder, there is a lining that protects the bladder from eliminating whatever you eat or drink. I didn't know that me eating French fries would be bad for my bladder, because obviously you think that affects the colon. But anything that you take in affects the bladder as well. Now, the inside of a bladder, for someone who has IC, there is no lining. You may have lesions, and then there's also called IC with hunters, and those are ulcers. And these are all extremely painful. Our disease is considered the third most painful disease there is. and we have been compared to someone who is in stage 4 cancer. So that's pain. Now, the muscles surrounding our bladder turn into, the way I like to explain it, is a protective wall that surrounds everything in your pelvic area, which means it becomes hard. It's not flexible. It doesn't bend. It doesn't stretch, which explains the reason why if someone who has IC, you can't stand up for very long, because you have no muscle control to help you with that. To squat down to pick something up off the floor, you can't get back up because you do not have the strength surrounding your pelvis area that helps you move. Now, there are ways to stretch them out a little bit more, so to speak, but it requires a very painful procedure 2 to 3 times a week for a lifetime. And for most of us, 1, you can't afford it, and 2, once you stop, it's going to come back to the way it is right now, unflexible. So the way it reacts to, I'll do the uterus first. If you are still having a menstrual flow, when you are having it during that time, your bladder is really angry because the uterus kind of expands during that time. So you're not only having the pain from the monthly issue, but you're also having the increased bladder pain because it's upset. So, and then move on to the colon. Most IC patients, once they're diagnosed, they get sister illnesses, is what I want to call it. Your colon gets messed up. You get IBS, which is irritable bowel syndrome. You can either have the diarrhea portion or the constipation, or you can have both. Anytime your colon is in spasm for being unhappy of whether you can go or not, this affects your bladder as well, because if the colon is spasm, so is the bladder. So it's just an entire, the way I like to say it is, they don't play well together in the sandbox. And if one is upset, the other one pretty much says, well, I'm going to be upset too. So then you just, you have this chaotic mess that you're trying to live with. And I'm not trying to make fun, because that's exactly how your body feels. You wake one part up, you're going to wake the rest up. So you want at least some of them to take a nap while you're having problems with one. Now, sometimes with IC, many times, you will have what's called a flare. And that's when your bladder can have a UTI in it, which is a urinary tract infection, or it could be from stress, it can be from something you've eaten, or it can be from the unhappy uterus or the colon. And flares can last days, sometimes weeks, and sometimes more. So, in order to get this under control, we need extra medication that can help the bladder stop the spasms, and that can take time. Now, I want to explain to you quickly the UTI, and then we're going to move on to the personal stories. A UTI, I think millions of you have experienced a UTI in your lifetime. And if you can remember how it felt, it was excruciating. It made you feel like you had to urinate every 5 seconds. And it was painful to actually eliminate your bladder. It could burn, it feels like it's on fire. Or it could feel like you're eliminating with razors. That's what IC feels like 24/7. Now, you can get rid of your UTI with antibiotics, and it goes away. Someone who has IC can have a UTI many times throughout their lifetime. But the unfortunate thing is, once the bacteria is gone and you don't have an infection anymore, the pain doesn't go anywhere. It just increases. So let me just give you an example of what this actually feels like as well, other than the UTI. Let's just say that you drink a little bit of battery acid, and then you need to eliminate it. How do you think that would feel? You think it would feel great? Burning? Peeing razor blades? Maybe a little bit of blood? That's IC. Welcome to our world. That's how it would be. And that's how it is for us all the time. Now, you may think that what I'm explaining is over-exaggerated. Trust me, it's not. I've been around this disease for 8 years, and I have known women for many years that struggle with this like me, but they have worse symptoms than I do. And if you can accept that it could be worse, it's just awful. So I am going to move on to some of the personal stories that we have gathered today. And there's going to be 3. And yes, you get to see me again. So we each have something to share because we're in different stages. And so I hope you stick around and watch the rest of the video because I think you're going to be informed, you're going to understand it more, and just walk away, hopefully, thinking that just because we don't look sick doesn't mean we aren't. Thank you. I will see you soon. Oh, Jesus, help me. Seriously, Jesus, help me. All right, now. Hi, this is Dina. Just a few minutes ago, I explained to you what IC is from a medical standpoint. But right now, I'm going to talk to you about how it affected me on a personal level and my whole wellness during this journey. I was diagnosed 8 years ago with IC, and between the first year and the 4th year, I went through so many treatments and so many different medications, and when they all failed, I could feel a piece of me die. By the 4th year, I could feel myself just breaking apart. I was just different, and I knew I was different. I started having very dark thoughts. It was hard for me to get through a day without thinking about how am I going to live through this for the rest of my life. I'm actually lucky. I wasn't diagnosed at 9, so I guess that's a plus. But no one should have to live the way that we have to live with so much pain. And after the very last treatment, I knew that part of my disease was over. Nothing they were going to do was going to help. So I put a stop to all of it, except for one medication that I do still take today. But by that 4th year, I was in a downward spiral. I ended up in a very, very dark place. And let's just say what it really is. I was suicidal. I was done. I just did not want to do this anymore. My body was just tired. Emotionally, I was a mess. Mentally, I wasn't strong anymore. And spiritually, I was very fragile. I have always had a strong belief in God. But I can honestly tell you that through this whole journey that I have been on, called IC, has made me stronger in every part of my life. Does that mean that I don't have bad days? No, not at all. I still have days to where I just cry because the pain is so bad and you have lost so much of what you used to be. The person that I was when I started this journey is so covered up in so much hurt and pain that I can never go back to that. And to be honest with you, I don't want to, because the person I am today is a much stronger person than I was then. I'm not saying that I was a bad person. I just am more equipped to handle what I deal with every day. It's still exhausting. It's still depressing. I still have anxiety, but I don't go to that dark place. While I was there, I could feel the wall that was closing in around me, and I was pretty much building it with my own mind because I didn't want anybody to know what I was thinking. So I had a secret from my family and my friends, and even my coworkers that I had worked with for more than 30 years. I was kind of surprised that nobody noticed, but I put on a pretty good act, I believe. Every morning I would get up and I would tell myself this is the day, because I can't make it through another day. And for me, you know, you can jokingly say there's a devil on one shoulder and an angel on the other. Mine were songs. My go-to for anything in life is music. One song that I got really stuck on was, to me, a song about choosing a different road to get home. And it was, to me, a better way for me to kill myself. And the other side was a Christian singer by the name of Plum, who her song was, hang on a little bit longer and you can still hear that soft voice. Well, I'm going to move forward to where I was right at the contemplating part of this is it. I finally got to the day that I wasn't going to do this anymore. But I was at work one day, and I called the pharmacy to see if my prescription was ready, and they told me it was declined. And that word put me over the edge. If I was straddling a fence one way or the other, that word took me over to the wrong side. That particular medication is the only thing I had that could cover the pain the size of a grain of sand. And just to hear that I wasn't going to get it anymore was destructive. The only thing I could think of when I got off the phone, I could feel myself shaking, and I just needed to get to my car. And then when I got to my car, I just wanted to drive. I made the mistake of calling my mother, because mothers don't want to hear that their children are having these thoughts. But what I'll get into about that, obviously I'm safe, and thank God I did not hurt anybody in that drive, because I don't remember getting home. I remember getting in the car, crying and screaming, and then I'm in the driveway. So of course, as you can probably tell, my story was out. The wall came crumbling down, and my family could see how broken I really was. They were very concerned, obviously, and so we got me some help. And I was in therapy for a while, and when I personally felt like I was strong enough to deal with this on my own, I left therapy. She didn't agree with me, but I did. I knew what I was feeling, and the darkness was not in my thoughts anymore. And I didn't listen to that song anymore, which would egg me into that direction. But what else in the dark place that I heard is I heard the words that I wanted to hear for 4 years, and that is, I can take your pain away. And that was so attractive to me. I just was it was like drawing a fly to something on your table. I just went right to it, because that is what was in my mind. I needed the pain to go away. And over here, it was just hang on, and I could barely do that. But what happened was, in that time, and over the last 4 years, is that I've become a much stronger person than I ever have been. That person that I was so covered in pain and disappointment and failures and guilt about not being able to do what a person normally does. And I don't want her back anymore, because I like who I am today. Yes, I still have IC, and I will always have IC, but I have a side of me now, or an inner feeling of strength that God has given me, especially over the last 2 years. When you go through personal trauma with any kind of chronic illness that takes you down like IC does, there is no way but up, because you're already down. So you have to find the strength somehow to move forward, because the day goes forward without you, whether you move with it or not. I made the decision to be with God more, And I know some people might not understand that, but the more time I was with him, the stronger I became. And I have to give him credit for making me as strong as I am now. I'm not afraid of IC anymore, and it has no power over me at all. I still get angry sometimes that I have this, and I can become frustrated because I make plans to go see somebody for lunch, and the day comes and I can't move. People have lost family members. I am very blessed. My family and my friends and my husband have stuck with me this entire 8 years. The thing about being a chronic patient with pain is that we have a connection, and we call ourselves warriors for a reason, because we are beating this disease. We're surviving it. We're no longer a victim to this pain. And that's the way we need to attack it when we get up every morning. That you're going to be a survivor instead of who this illness is. It's not who we are, it's what we live with. And we survive it every day. But unfortunately, there are some brothers and sisters of IC that, for some reason, whatever reason there is, feel like the only decision they have to make is to kill themselves. And unfortunately, that's a choice you can't come back from. We won't ever walk alone because there are millions of us out there. So I always feel supported by my brothers and sister warriors. My pain is their pain. My story is their story. And there are many people that do not feel comfortable coming out and being a voice, or as we like to say, maybe an ambassador for the rest of the people who carry this chronic disease in their life every day. That's what we are. I will never give up fighting for something to treat or cure this disease as long as I'm here. I'm one of the people that is not afraid. And it's really not fear. It's a comfort thing. Sometimes it's a real personal thing for somebody that they don't want to talk about. Now, I could have gotten into the really details with you, but I think you're understanding where I was and how I'm feeling. And that's pretty much how everybody feels. But they probably have a different spin on their story. But, like I said, their story is my story. Pain is pain. And you know the saying that it takes a village? I like to turn that around and say it only takes a few to cover a village. And that's what I'll do until my job here is over. I will be as loud as I possibly can. And I will wake up every day and be hopeful that this possibly could be the day that something happens to help us in this fight of pain. This morning I woke up to a video that a mother has posted because of IC Awareness Month. And her daughter took her own life a year ago. And just to see the brokenness of this mother and this beautiful young woman who was only 26 years old, who decided that there was nothing else she could choose but to be gone. That is an emotion that stays with us. Now mine is not even a fleeting thought, because I know that that's not the answer. And it really hit home just watching how this mother has just been destroyed by losing her daughter over a disease that it feels like nobody cares about. But she's a voice now. She's determined to be out there and telling her daughter's story and getting more attention for this illness. So as I said, we don't walk alone. We have millions that are on our side. So I thank you for letting me share a small portion of my personal story. I will never give in to I can take your pain away again, because that's not what life is about. Life is about surviving and being strong and putting your faith into a hope that's eternal. By God's grace, every day I get up and I move forward, and I do try to do the best that I can. So thank you for your time, and thank you for watching this video.
Hi, my name is Jennifer Carey. I have been a survivor of interstitial cystitis since 2013. That, in turn, began a journey of a long line of chronic illnesses for me. I have always had urinary problems as a child. I used to get urinary tract infections a lot, and luckily that seemed to resolve itself once I hit adolescence. And then when I gave birth to my first daughter, I was only 18, and kidney stones began to be a common experience for me. A lot of these kidney stones were too large to pass. So I always have had a urologist on board. In February of 2013, it was right after my wedding anniversary, I was in excruciating pain, and I was almost positive that they were going to tell me that I had a kidney stone. So I went to the ER, because at that time I didn't really have a primary doctor, I just had a urologist. So I went in and all the tests came back negative, but they treated me for a urinary tract infection anyway. I finished the antibiotics and my symptoms were still there. They, in turn, let me repeat a dose of antibiotics, and it ended up being about 20 days of antibiotics, and I was still in a lot of pain, and I was scared because they kept telling me that all my tests were normal. I went back into the urologist office, and they ran more x-rays, and they took more blood work, and they tested my urine yet again. She told me at that point that I had an angry bladder, and that she was hoping that the inflammation would resolve itself. It didn't. I kept telling her that my pain was getting worse by the day. I remember I would wait until my husband and my children were asleep at night, and I would cry. I would cry because I knew something was wrong with me, but I didn't know what was wrong with me. They wanted to go in and perform a procedure that's called cystoscopy with hydrodistension. That is when they put a camera up your urethra so they can get a better look at your bladder. At this point, I was fearing the worst. It had to be bladder cancer because the amount of pain that I was in was excruciating. It really was. And with hydrodistension, what they do is they fill your bladder up to capacity. A normal bladder will look normal. An IC bladder will show bleeding points. During this procedure, when I woke up, all I was told by my family members was that I had bleeding points, and I am officially diagnosed with interstitial cystitis. I was given a one-page pamphlet on the disease that did not really tell me much. I went home scared because the more I started to look into it, the more I was reading incurable and not many treatments, and it was scary. And slowly but surely, because one thing that they never tell you is that interstitial cystitis is an autoimmune disease that is directly related to sister illnesses such as fibromyalgia, endometriosis. These are two that I suffer from. Shortly after interstitial cystitis, I experienced symptoms of endometriosis. My endometriosis was so bad, I had to have a radical hysterectomy at the age of 32. I am in medical menopause. My fibromyalgia causes me pain to the point that I have to make plans throughout my day. My IC is relentless. I can't go anywhere without knowing where a bathroom is. I've had to change my eating habits, my lifestyle habits. And in turn, with all of these diseases that come, is a weakened immune system. As I'm speaking to you right now, my voice is a little off because I am recovering from pneumonia. I got pneumonia as a complication of the flu. I get sick very easily. I have been hospitalized for infections a total of 3 times now, one of which they were very afraid for my health. I now wear my heart on my sleeve, and I have what I call my warrior tattoo. And it's hard to believe that this whole journey started with the 4 words, "You have interstitial cystitis." I've tried almost all the treatments, which there isn't very many, and I still cannot find relief. When you live in chronic pain and there's no relief, what comes along with that is depression. And within that depression and unrelenting pain comes the sensitive topic of suicide. And the reason I want to bring that up is over the years that I have been ill, I have met a lot of ladies that are in support groups, that own support groups. I now own one myself. And over the past 2-3 years, just in our little world of support groups, we've seen about 7 to 8 suicides. And if it's that way in our little world, I don't know what way it's got to be on the bigger scale of things. And it's hard to discuss, but I think it needs to be discussed. September is IC Awareness Month. The ICN network, their slogan this year is, how many more patients do we have to lose to suicide before our pain is properly addressed? I think a lot of us beg to ask the same question. Anyone that's chronically ill, or even people that are aware of the news around us, we are in a pain pill opiate epidemic in this country because of overdoses. They want to prevent the abuse of the drug, which essentially is a great idea, but I feel like it is creating a different problem. I have seen a pain specialist, and they've told me that they will not help me. A lot of times people look at me and they do not understand, because minus my voice right this moment, if you look at me, I don't look sick, but I am sick. And my medical records show that I'm sick. And it seems to be a double-edged sword, but it needs to be addressed. A lot of people feel like there's no hope with these diseases. There's no cure. There's no explanations. A lot of times we educate our doctors. And the few times that we do come across doctors that do know what our disease is, it's an amazing moment for us. We need to let everyone know what interstitial cystitis is, for us, for our children, for future generations. I hope everyone shares this video. At the end of the video, the National Suicide Prevention Hotline will be listed. Please utilize that for anyone that you feel needs it. We need to let everyone know that someone's here to listen, and that despite the pain that we go through, we are here for each other. I often mourn my health, my old self, and I don't necessarily like my new normal, but the one great thing that has come out of my new normal is that I have met some really amazing people that have become like family to me, and we understand each other, and we are there for each other. And I would really appreciate it if everyone would just share this video.
Hi, I'm Mandy Southerland, and I'm going to tell you about end-stage interstitial cystitis and what I had to go through in order to get where I am today. Whenever I found out I had interstitial cystitis, I went through potassium tests, and that, thank God, is no longer needed today. In fact, that's not how you get diagnosed. After I had the potassium test by my gynecologist, he sent me to a urologist. My urologist used the hydrodistension and cystoscope to diagnose me with interstitial cystitis. After I was diagnosed, I went through a series of treatments, and those treatments included medications. The main medication for IC is Elmeron. I was on it several months before I was able to tell anything, and even then I could barely tell that it was doing anything anyway. They immediately started me on instillation treatments, which consisted of heparin, sodium bicarb, lidocaine liquid, and lidocaine gel. I was doing these in the beginning 1 time per week, but towards the end up to 5 times or more per day. I also went through the InterStim implant, which is like a pacemaker for your bladder. I went through Botox injections inside of my bladder. The only time I took pain meds is after a surgical procedure. I didn't like the way they made me feel. I also went through, after all of this, I went from being diagnosed in 2003 to 2008. I had to have my bladder totally removed. In the 5-year length of time, my IC progressed aggressively. There was nothing really they could do to stop the progression. I done everything that I could. I even done the elimination diet, everything. I stuck to the diet the best I could. With end stage, it is hard to get control of everything. I could look at a bottle of water and start flaring. I spent many nights in the bathroom, on the toilet, sleeping on the toilet, because otherwise I wouldn't get any rest. With the bladder removal, it is a very serious step. I had no Facebook, because back then Facebook wasn't even around. MySpace wasn't around. I didn't have any support groups. I didn't have a way to research IC. I didn't have a way to research this procedure. My doctor did, however, introduce me with 3 ladies that he had done this surgery on prior to me. I was actually the 4th lady that he was doing the surgery on. I was able to talk to these ladies on the phone, text them, and I was also able to meet these ladies in person before I had my surgery, which helped me tremendously. And I was so ready for this surgery. I was so miserable. In fact, I was so miserable that I begged and pleaded for a Foley cap and leg bag. This disease is so depressing and so painful. And whenever you're going through such pain and depression and you're being sleep deprived, you will do anything to make yourself feel better. I would get up every day and I would do my makeup, I would do my hair, I would do my shower and everything, of course, but I've done that to make me feel a little bit better. And it's like today with my fibro, I still do the same thing as a way to make me feel better. And that's what we do. But anyway, back to the pouch surgery. With this surgery, it is so severe that it is more severe, more delicate than even an open heart surgery. And the reason it is because you are cut open for nearly 10 hours. Because they have to be very careful the way they do this. When you're laying there, you're asleep, of course. They monitor everything, and they are very careful. You're having your bladder removed. Some doctors leave it in, some take it out. I have my bladder totally removed. My urethra is totally removed. The doctor said that my bladder was so eat up with IC that it stunk like rotting tissue. My urethra was nothing but mush. My bladder practically fell apart in his hands. Whenever they removed it, that was it. He made what is called, it's a internal urinary diversion called the Indiana pouch. They made this out of part of my large intestine, and that is just inside of my belly. It's not down where my bladder was. They made a stoma out of the ileum. It's part of the small intestine, and that is located to the right and just below my belly button. So now I cap through the stoma to empty the pouch. I do this every so many hours depending on how much I drink, and it's great. I love this. I have no IC symptoms. I never say that I'm cured because that would be a lie. I don't want to give false information. I always say that my IC is in remission. And I say this because of the fact that yes, I can get IC back. There are others who have the Indiana pouch who do have IC in their pouch. There are people who did not get to have the Indiana pouch. They had to do the external bag instead due to whatever the reason was. I know people who have IC in their stoma. I know people who have it in their stoma and in their kidneys. So the possibility of IC returning is there. So I'm doing everything I can to just remain healthy and enjoy life the way I can. And I do these videos to help educate others on IC and what I had to go through to get where I am. And this is how I do it. I do videos. I just help other people the way I feel like I'm supposed to. So I'm hoping that this helps other people that are watching this video. I have YouTube videos. So, I mean, if you guys want to watch the YouTube videos, feel free to share those videos. I've had people that have actually shown their doctors my YouTube videos because some doctors are just not all there. That this is for IC awareness, and that's why we're doing this video. I hope and pray that you guys got something out of this, because this is the life that we have to live. So, God bless each and every one of you. Bye.
Hi, this is Dina. I wanted to take just a few minutes to close out our video for IC Awareness Month. On behalf of all of us who were involved in the video and the IC community, we thank you for taking time out of your busy day to watch this video for IC Awareness Month. It really does mean a lot to us. It's not just an invisible disease to us, it's invisible to the medical community. So who knows, maybe one of you are the ones that we need to get to hear our story, and so our voices can get out there and be heard. I would like to take a minute to thank the beautiful ladies at the beginning of this video, and that's Amber Neff, Georgeanna May, Jennifer Carey, and Mandy Southerland. And I would like to make another thank you from me for these other three ladies that wanted to share their journeys, and that's Jennifer Carey, Heather Maitland, and Mandy Southerland. And I hope you stay on for the rest of this video, because there are many women that wanted to be involved in this video to do something for IC Awareness Month. Watch the video, and I hope you enjoy it, and I hope that we were informative enough for you to understand why we fight so hard and why we do call each other warriors. Thank you.